So, hello, my name is Taewan Kim, and I recently completed my PhD at KAIST. And today I'm really excited to share with you our project called Mindful Diary. And this work was carried out during my times as a research intern at Naver AI Lab under the guidance of my mentor, Dr. Young Kim. So to begin with, I will talk about the backgrounds and the motivation for this research. So, keeping a journal is a powerful method for enhancing our mental well being. The simple act of writing down our experiences and emotions can have a significant impact on reducing stress, anxiety, and depression. Especially in a clinical setting, journals can play a crucial role as a patient generated health data. So, the journal can provide insights into patients' experiences and health. And these insights enable clinicians to better understand their patients, including their challenges and thoughts from the patient's own perspective. However, journaling past experiences can be difficult for individuals facing mental health challenges. Research has shown that for those with mental health issues, the task of writing a coherent narrative from past experiences is really challenging. Furthermore, recalling and writing about feelings can be a complex process because people differs in their ability to identify and translate their emotions. So these difficulties highlight the need for supportive tools that can help users in capturing and documenting past experiences. So one way to ease the challenges of journaling is through the use of conversational AI. So studies have found that the interactive and supportive environments offered by conversational AI can encourage users to write more openly and truthfully about themselves. However, the use of conversational AI in mental health domain has mostly been rule-based or retrieval-based. This means it is structured to respond to specific cues and retrieve pre-programmed responses, which can limit its ability to handle unexpected user inputs. And these limitations present missed opportunities regarding conversational AI that assist with journaling by suggesting, questioning, and empathizing based on the user's diverse experiences. Meanwhile, large language models have shown the ability to have contextualized, open-ended, and naturalistic conversations across various topics. And this capability of LLMs, which can aware of various topics and adaptively generate responses, can overcome the limitations of retrieval-based chatbots. So with this background, this study introduced the LLM-driven journaling app, MindfulDiary. MindfulDiary leverages LLMs to assist the journaling for patients and to support clinicians in understanding their patients. Especially this app was developed in close collaboration with mental health professionals. So next, I would like to explain the concept and design of Mindful Diary. So in the beginning of this project, we conducted a formative study with clinicians from the Department of Psychiatry at University Hospital. And we were able to find out that clinicians need data-driven consultation support based on patients' daily data. One of the major challenges from the clinician was that it is difficult to understand patients' daily conditions and thoughts. Furthermore, due to the fatigue and lethargy that is the typical symptoms of patients with depression, when doctors ask patients about their conditions and experiences, most patients respond with short answers. Additionally, it was found that patients need assistance in engaging in reflective practice such as a journal writing as a method for continuity of care. which helps them manage their mental health on their own. In particular, help was needed in recording past experiences and daily lives in detail and richness. So with these challenges in mind, we designed and developed the Mindful Diary to help individuals with mental health issues better reflect and express themselves, and to support healthcare provider in gaining insights into patients' daily lives. So therefore, the Mindful Diary consists of patient interface and clinician dashboard. First, let's see how the patient interface actually works.
First, users log into the Mindful Diary using their account information. The home screen provides helpful information for understanding the program and allows users to check the most recent journal entry date. Now, let's examine the journal writing process through conversation. The journaling session begins with a pre-journaling assessment. Users complete a modified PHQ-9 survey before interacting with a large language model. Following the assessment, users engage in a dialogue with Mindful Diary to discuss their daily experiences. Mindful Diary offers prompt questions designed to aid users in reporting specific and detailed accounts of their day. Users can input their experiences through either keyboard or voice input. After 3 turns of conversation, a summary of the journal is generated based on the user's input. Users can edit this summary as they wish. Once the summary is displayed, users can choose to end the session whenever they want.
So as you can see in this video, the main feature of patient interface is about providing reflection questions to help patients explore their inner selves. Then these interactions are also visualized and summarized in the form of diary to help patients who have difficulties constructing coherent narratives of their experiences. Then how does the LLM operate in the patient interface? In developing Mindful Diary, the emphasis was on constructing a system grounded in expert knowledge and experiences. For achieving that goal, the approach we use to design and control the LLM's behavior is a state-based approach, which enables more stable sentence generation by breaking down the complex tasks into a specific subdivided individual prompts. And the subdivided prompts modules are composed of rapport building to establish initial trust with patients, exploration to delve into the patient's experiences and emotions, wrap up to conclude the conversation, and sensitive modules to respond to patients' input about suicide or self-harm. So as you can see in this figure, after receiving user input, the system first analyzed the current conversation state based on the entire conversation log and the number of turns so far using an LLM, which is a GPT-4, then operates another LLM with a prompt focused solely on the specific state to simplify the prompts, and based on this pipeline, responses could be generated in a more stable way. And the data collected through the patient interface serves as a channel for clinicians to better understand their patients. For this purpose, the clinician dashboard provides information on user engagement, journal, and insights. So we conducted 4-week field deployment study with 28 patients. Participants who are outpatients first used the app and then visited the hospital after a week, where their healthcare providers were able to use the journal records in their consultation. So in this presentation, due to the time limits, I would like to share some of our findings on how Mindful Diary supported patients' journal writing. First, through the study, we were able to collect more than 4,000 patient Mindful Diary interaction logs, and we are also able to demonstrate that Participants wrote in their journal at least once every 2 days, and that patient engagement level were sustained over time, which was confirmed by the clinicians as a significantly higher than the traditional paper-based program. In particular, we were able to see where LLM could play an important role in patients' journaling and reflection process. First, LLM's versatility in documenting diverse interests supports participants in detailed journal writing. We found out that flexibility in responding to various topics enhance user engagement. The topics include details about novels they read, recent movies they watched, hobbies they engaged in, and music they listened to. Especially in our study, we were able to find a case where LLM comprehend the information about the medications, and this understanding leads participants to document their detailed reaction to the medication. And another significant advantages of LLM was building narratives. The LLM's ability to connect fragmented experiences with associated emotions and thoughts, enabling users to record their experiences in a logical and coherent manner. Next, a large language model played a crucial role in helping people look at their challenges and experiences from diverse perspectives. In our study, LLM-generated responses offers new perspectives, aiding reflection. For instance, as you can see in this snippet, consider a student struggling with academic difficulties. Mindful Diary proposed a novel approach likening the process of academic growth to advancing levels in a game. And these suggestions prompted the participants to view her academic struggles through a new lens, alleviating some of the stress associated with her studies. Clinicians have highlighted several benefits of using Mindful Diary, including enhancing understanding and empathy toward patients, insights from everyday perspectives outside clinical visits, and understanding patients' progress through consistent record keeping. E3 mentioned that patients with the support of AI can logically continue their narratives, ensuring more dialogue than a typical paper-based diary. This definitely aids me in my consultation. So in this study, we present Mindful Diary, an LLM-driven journal designed to document the daily experiences of psychiatric patients through naturalistic conversation. So one of the implications of this study is that we identified the potential of LLM as a facilitator for fostering patient-provider communication. In our study, LLM assisted journaling by lowering the barrier in documenting daily lives and helps clinicians get insight from the patient record. We believe that this approach could open up new design space for improving patient-provider communication using the LLM. So in conclusion, we've demonstrated the potential of LLM technology in the mental health and journaling domain by facilitating interactive journaling process, enabling patients to more deeply express and reflect on their daily experiences. And by overcoming the limitations of traditional rule-based chatbot by offering more adaptable, understanding, and empathetic interaction model. And by providing clinicians with more comprehensive view of their patient's condition outside of the clinical visits, insights facilitated by LLM. So we hope this work provides insight on the integrating LLM technology into a journaling practice and the broader mental health domain. So thanks for listening this presentation, and if you have any question, feel free to contact me anytime. Thank you.